Okay, I'm going to my oncologist today. See back here. So we'll see what he says today.
Hey, Miss Casey, how are you doing?
We're all right.
It's good to see you. You've been busy.
I know.
Seeing different doctors and doing all sorts of different things. You doing okay?
Yeah, it's just anxious about it all.
Yeah. So how did your appointment with Dr. Asher go yesterday?
It went good. Yeah.
Good. Now we texted and we tried to call each other both twice and we never quite connected. So I haven't talked to him yet about how it went.
Yeah.
What did he tell you about the appointment?
Well, no, I go back tomorrow.
Okay.
For the CT markings and all that.
Okay.
Yeah.
So he's getting ready to do the radiation.
Yeah.
Yep. Okay.
You think he'll start Monday or?
Yeah, potentially. And so
Well,
what we usually do is we do he explained to you probably, we do a little bit of chemotherapy with the radiation to make the radiation work better. Okay.
Now the chemotherapy, is that going to be pill or?
So we can either do pill or an IV infusion.
Which will not make you nausea?
Which will not make you nauseous. So here's the differences. So one is done through the IV, okay? And so in some sense it's easier because you just come in, they do it to you, you can forget about it, okay? It's a little bit less nausea, but sometimes you have to get a port to be able to give it, okay? So you get a procedure, get it put in, right? The pills, you take it twice a day, okay? It's the port, don't have something in your body, but you have to absorb the chemotherapy through your intestines, and that can sometimes cause a little bit of nausea and upset stomach. Okay, it just is the way it is. And so in Europe, they only use the pills. Right? Everyone uses the pills, that's fine, you agree with it. But for some reason in America, we've got weaker stomachs or something that it causes a lot more symptoms for some people than they experience in Japan or in Europe.
Well, the other thing I have with the pill is how big is it? I cannot swallow a big pill.
Oh, I don't really know how big.
I know it's
Let me Google here, see how big this loaded pill is. I've actually never had one before. I mean, I never looked at it to see how big it was. This is Loda.
I don't mind nausea, but vomiting, or especially when
you shouldn't throw up or anything. No, that shouldn't be. That'd be fine. So let's see. So if it's in like a cap, like that size. So I'd say it's like a medium size. It's a medium size. It's not a giant horse pill. But it's also that's not. So it's not a teeny tiny little one, but it's not like a big honking huge one. Well, what do you think?
I don't know. And it's powdered, ain't it? And not no capsule.
It is a tablet. So it's not a capsule, but it's a tablet. So it's like powder in the inside, I think. So what do you think? So I guess that's basically what we do is we give you chemo during it to help sensitize the cancer cells to the radiation. Okay, it makes them more sensitive and helps radiation work better. And then depending on how that goes, we can sometimes follow it up with some chemotherapy afterwards. Okay, and in some cases we can avoid doing a surgery altogether. Okay, sometimes this cures it and gets rid of it. You don't even need to get a surgery to cut it out. Okay, it's always an option if after we do all this treatment, there's still some cancer left over. Is that what Dr. Asher told you?
Mm-hmm. Yeah.
But hopefully, my hope in most people.
Now he thinks it's stage 2. Is that what you think?
Yep. So we did the MRI. There's no lymph nodes involved. We did a CT. There's no other spots anymore concerning for cancer. So yeah, it's just there in the wall of the rectum. So we caught it early.
Well, now can you explain it to me? Because like when I feel it, it feels like it's just a ball beside by itself. But is it the wall of the rectum it's in? Or?
Yeah. So what it is that it starts. I'll pull the actual report so you can see when I tell you what it is. So what they say is it is locally invasive anterior anal mass. Right. So there's a mass. Like it's anterior, so that means it's on the front side, so that's why it's pushing towards into your vagina, right? It's not going into the vagina. There's clear, when you look at them right, there's still healthy tissue around the mass, so it's not invading into it, but it's really pushing the healthy tissue in towards, right? out of the way. They did say there's a difference between cancers of the anus and of the rectum. Right, so the anus is like the canal where it comes out, where it's kind of some skin tissue, and the rectum is sort of still the intestinal type of cells. Yours has a lot of mucus, the tumor did in the biopsy, so I think it's technically a rectal cancer. That's just down at the very, very bottom. Okay. Now the challenge is for doing a surgery on these is that oftentimes if it's inside the actual muscle that controls the anal sphincter, when you do a surgery, you got to cut that, and it makes it so you can't control your stools anymore. Sometimes we have to end up with an ostomy bag if they do surgery. Okay. So that's why we like to do radiation and chemotherapy. So if we can get rid of it, we preserve your bowel function, and get rid of the cancer. Okay? So that's why some people ask, why don't we just do a surgery and cut it out? And the reason why, we could, but if we did now, we'd have to cut out your anal sphincter, and then you'd have to get an ostomy bag for the rest of your life. Which most people say, I'd rather not. I'd rather be that.
Yeah, because of course I don't know how they're up to date, because I did private duty one time, and a lady had ostomy, and back in those days, I don't know how it is now, but you had to wash it out, and I kept orange peelings everywhere.
Oh, you had to wash the bag out and replace it?
Replace it, yeah.
Oh, no, they just send you new ones now.
This is 1980,
no, they send you new ones now.
And I think, oh,
yeah, goodness gracious. Yeah, no, so it's better. I just had a lady we talked to today about she's having to get a surgery for hers potentially. Hers is much more advanced stage than yours, and so I'm not quite sure the chemo and radiation got rid of all of it. So she may need to get the surgery to completely get it all out, and so she's really nervous about an ostomy. But even then, if that's the case, it still cures the cancer.
As I say, yeah, I mean, it ain't bad other than just the smell.
Yeah, exactly. And that's what I was
of course, psoriasis is the same way. You have a type smell. So.
Yeah, exactly.
Well,
let me see if this is Dr. Asher right back there now. No, there's not. So what we're going to plan on doing is getting things set up. You seem kind of anxious about the pills. The pills are probably the easiest to kind of get things started, because it's not to get a port placed and that kind of stuff. So from a ease of getting things beginning, I put the order in, the prescription gets sent to a certain pharmacy, they mail you the drugs, you start taking the drugs in the days of...
What is it, a type pill that can be put in applesauce, or?
Yeah. You mean like crushing it?
Well, I don't know. Oh, however, yeah.
Let's see. If I actually don't know if you can. No one's ever asked me if you can crush the.
I mean, I could try and just see, but.
I think you can. I think we can put it through tubes, like feeding tubes. I think. No, it says do not crush it. It needs to be crushed. Do it by a doctor. They're not going to crush it. You know what I'm going to do? You ask one of the nurses out there if we can crush Solida. Okay?
Well, say like I couldn't take the pill, you go the other route.
Yeah.
But now this is less, of course, I don't mind nausea. I've been having nausea for the last 2 or 3 days. I don't know why. So.
Yeah, maybe because you're nervous.
Well, it's right there, because, it's just
yeah.
Because the only thing is, like, when I, one time 2 years ago, I about aspirated. I got that stomach bug. I couldn't vomit and couldn't breathe, and
goodness gracious.
So you get a fear, you know.
So I think what it is, the concern with, I think it can crush, you can crush them, that it still works. But I think the issue is that you're then crushing a chemotherapy drug, and people get worried about it's going into the air or something.
Right.
Who was at home with you?
Nobody.
No, it's just you?
Yeah.
So it'd be fine. Like, if you crush, it's not going to cost, like, it'd be like if you had kids around, and you're crushing up your chemo and they walk by and inhale some of it, or, that might be it, or get it residue on the table and they lick it, eat it, that could be bad. But if you're just home by yourself, that's fine.
Well, I'll try, the peel,
Yeah.
Because, I mean, if they get rid of the,
Yeah. So
now, as you're taking the radiation, will you feel it shrinking, or?
Yeah, sometimes you do. Usually what happens is, as it builds, so you're going to do this for quite a few weeks, right?
6 weeks.
And so as you build, the first week or two, you don't feel much of anything. You do a bit of tiredness, but you might notice it shrinking a little bit. But over a while, it just gets a little bit irritated and inflamed, like a sunburn at first. And then it's hard to tell. Usually you can tell it's shrinking, but it's sometimes hard to tell because it just gets angry, and so you can't tell if it's just swelling of the skin, or is it as it's shrinking, your skin around it's also getting inflamed, and so sometimes it's hard to tell. But the vast majority of patients respond very well to this treatment. These tumors are very sensitive to radiation, so it'd be very, very unusual for it not to shrink and almost go away. Okay. You just got to get through it. All right. So let me go get some paperwork for you explaining the medicine. Okay.
Okay.
Kind of what to look for in side effects, and then I'll put the orders in, and we'll kind of get things rolling, okay?
Okay.
All right.
Now, is that drug expensive, or?
No, it should be. No, if your insurance will cover it, and if not, there's patient assistance programs where we can get it. No problem.
Okay.
Yes, don't worry about that.
All right.
Okay. So let me go print some stuff out real quick. I'll be right back. Okay?
All right.
Version of 5-FU is called capecitabine or Xeloda. It's the same drug, but it's in pill form. You take it twice a day, usually 2, 3, 4 pills twice a day, after breakfast, after dinner. Any single dose that you take it, no side effects, 0 side effects. A week's worth, generally 0 side effects, no real side effects. It's not for a month or so that they start to build up. And what you can get is some peeling and cracking on your hands and feet. You can get some mouth sores, occasionally some diarrhea. Fatigue is part of it. Sensitivity to the sun is one of the side effects. Rarely can you get bad GI side effects or bad problems with your bone marrow. So in general, pretty well tolerated medicine.
Okay, I'm fixing to leave, so there we go. Look at the